Good morning and welcome to Trevor Phillips on Sunday. Boris Johnson won't be the first person in the world to discover that breaking up is hard to do. You don't have to be a die-hard Remainer to observe that separation from continental Europe isn't quite as straightforward as many people hoped. Taking control of our borders hasn't stopped the flow of migrants across the Channel from spiralling tenfold to probably 25,000 this year. And the surge in COVID infections has prompted fresh lockdowns and rioting in the EU. That has health service bosses looking nervously at the horizon as winter approaches. Of course, no one can pin racism in cricket on the neighbours. Our troubles in the game we invented are all homegrown. We'll be discussing that and much more with our guests this morning. Coming up in the next hour, we'll be speaking to Health Secretary Sajid Javid. The Shadow Home Secretary, Nick Thomas-Symonds, joins us from Cardiff. We've got Chris Hopson, the Chief Executive of NHS Providers. That's the organisation that represents most hospitals in England. And one of the UK's most prominent public health experts, Professor Linda Bauld. We'll also be hearing from the Vice Chair of the Northern Powerhouse Partnership and lifelong Manchester United fan, Lord O'Neill, who we might speculate has had a pretty tough week. But first, let's go straight to the Health Secretary, Sajid Javid. Good morning,
Good
Health
morning.
Secretary. You've announced a review into the use of oximeters, which have led to an underestimate of the treatment needs of people of colour. Is that an admission that our health services have a systemic, undeclared racial bias?
You know what, there may actually be a health services across the world, a systemic racial bias, I'm sad to say. And this came about because, you know, there's lots of health disparities in our country. There are in many countries. But we saw that, I think, quite acutely during the COVID crisis. If you were from a BME background, you were a third of admissions were from BME background in ICU units at the height of the crisis. And that compares to, that's more than double the representation in the population. And I asked my team to look at this in some detail. I wanted to really understand what was going on. And one of the reasons they came back with was around pulse oximeters, a medical device that tells you about your oxygen level, crucial with COVID and combating COVID. And in many cases, it was giving false readings. And you know what really got me was that this was already known. There are research papers already on this, and no one did anything about it. Now, I'm not saying this was deliberate by anyone. I think it's a systemic issue potentially with medical devices, and it may go even further than that with medical textbooks, for example. And so that's why I've announced today that this is something I think that we should do something about, not just here in the UK. I want to work with my colleagues across the world. I've already talked to my counterpart in the US, and he is as interested in this as I am, and see what we can do, because clearly something like this can never be acceptable.
As you said, this is not just something we've discovered with COVID. This particular thing was known before. There's been lots of work which shows that medical trials, which I think you've mentioned, are frankly, the samples, which contain thousands of people, are often racially biased, with not enough people of colour in them. And of course, we've had a report from a group of MPs this week about the treatment of people with sickle cell anemia, who are almost exclusively black, and the deficiencies in that. Bluntly, can, frankly, people like you and me really trust that the NHS is going to treat us fairly?
I think we can trust the NHS, but I think, of course we can. And let's not, the NHS has been there for all of us for decades now, and helped every community in Britain. And that's, of course, something that is right. But we should always be looking to see what can be done to improve things. And this particular issue about racial bias in medical instruments, it's global. It's nothing to really, I think it's not really about the NHS. It's a global issue. These oxiometers are being used across the world. They all have the same problem. Some of the other issues we've come across, and you've mentioned around sickle cell anemia and things, these are global issues. And I think Britain is in a place to take some leadership on this. And as I say, as I've discussed it with my counterparts, some of them have been surprised about this, about the evidence that I've presented them with, but they are all united in wanting to do something about it. And I hope that I'm in a position over the next few years to do more about this and let Britain take the lead.
All right, this week we've seen the return of lockdown across Europe. Do we need to prepare for more restrictions here before Christmas?
I think as we all look forward to Christmas, it's very sad to see cases rising, surging in certain parts of Europe. Now, we've always known that this virus, it loves the winter, it likes the cold, darker days that winter brings, and we need to make sure we're doing everything we can to protect ourselves against that. What's made a real difference here in the UK is our booster programme, our hugely successful booster programme, almost 15 million booster jabs given already, covering some quarter of the population over the age of 12, almost 400,000 a day across the UK. And that's making the difference. And we know that because just this week there was more data published after more studies that shows that the protection you get from your booster, the change in your protection, it almost doubles from 50% to over 90%. And I'll be extending the booster programme starting tomorrow to 40 to 49-year-olds. But, all of us, we've all got a role to play in this and in our national vaccination programme. And if you're eligible for whether your first shot, second shot or your third shot, please come forward and let's look forward to Christmas together. All
the same, as one of my Australian friends said about COVID-19 just before they went back into huge lockdown, this thing is a tricky bugger.
It is.
Shouldn't you be dusting off Plan B, vaccine passports, requirement for masks, just in case?
Well, the first thing I'd say, Trevor, if I may, is that we made a tough decision back in the start of the summer. Other countries didn't follow our course, and we decided that, of course, we want to start opening up. And if you're going to do that, it's best to do it into summer. It's far safer to do it in summer. Sadly, other countries in Europe did not do that. But looking ahead, as we look down towards winter, we need to make sure that we remain cautious. We are not complacent in any way. I've mentioned the importance of the booster programme, but in terms of any other potential measures, we've said all along we've got Plan A, and that's where we firmly are at the moment. If we needed to take further measures with Plan B, then we would do so, but we're not at that point.
Yeah, but I suppose you've pinned all your hopes on the vaccine rollout successful, booster programme going quite well. But isn't the truth here that this is a disguised form, frankly, of herd immunity, either through vaccines or through natural immunity induced in those who've had COVID? Isn't this really still pretty risky?
I wouldn't accept the way you've put it, really. And if I may, and the reason is because, of course, the vaccines are a hugely important part of our protection against this horrible virus. But beyond that, there's a lot else going on. So
you have basically let it go far in the hope that the vaccine would get ahead of the spread.
No, not at all. If you look at what else that we are doing, look at our testing system. We have a juggernaut of a testing system, more than, I think, any other country in Europe in terms of the availability of tests, the type of tests. We have a surveillance program that is the envy of the world. We have clear guidance out there. We've taken decisions, for example, the one I announced last week around NHS compulsory vaccinations for people working in the NHS, in care staff. So taken together, I think these are, of course, the right measures. But where I think you would be right, of course, we need to remain cautious. This thing can be very unpredictable, and we need to be ready and monitor the data extremely carefully, and that's exactly what we do.
But cautious relative to, I mean, even in the UK, England is an outlier. Yesterday at Hampden Park, fans were required to show that they had been double jabbed before they could get into the stadium. Today, Man City are going to play Everton, 52,000 people, no requirement to show you're double jabbed. I mean, we are taking the risky path.
But we've made a decision in this country to take a different path in some ways. We don't have the so-called sort of vaccine passports. If an operator, a venue operator wants to take additional measures, that's up to them. But I think the package, the balance that we've set out in Plan A and then making sure that we've got contingency measures in place, the so-called Plan B, I think has been the right path, has been proven to be the right path. I think we can safely say that so far. But as I say, we can't be complacent. And can I also mention the flu jabs? Yep. The flu jabs are a hugely important part of our winter plan, and we're seeing record numbers of people come forward for those as well. It's the biggest flu vaccination programme this country has seen, and that's just as important this winter as COVID booster shots.
Well, look, forgive me for banging on about the risk here, but we know what the real issue here is, that the NHS will be overwhelmed. I'm going to talk to Chris Hopson, the boss of NHS providers, later, and he's going to tell me that it's dire. You yourself have said that waiting lists could climb as high as 13 million. Do you happen to know, by the way, where we are on waiting lists this weekend? What's the number?
It's 5.9 million, roughly, and waiting for people waiting for elective procedures is around 5.9 million. And as I've said, I've been really clear, this number is going to go up before it comes down. Why? Because some 7 to 8 million people stayed away during the height of the COVID crisis because they were asked to. They did what was asked of them. But I want them to come forward. I want them to come back to the NHS. I want them to know that it is open to them. And if you take that along with normal demand, of course, that's huge pressure. And can I say, you're right to talk about the pressure on the NHS. It is significant. And I think everyone working in the NHS, and certainly from everything I hear, everything I've seen, they are doing an absolutely amazing job, and they will get all the support that we can possibly provide. 5.9
million. Are you actually going to wait till we hit 13 million before you do something like, for example, bring the Nightingale hospitals back into operation?
Well, the 13 million number was if we'd carried on with business as usual. Of course, what we've done in the last couple of months is set out our plans for the longer term, not just this winter, but over the longer term, with the new funding settlement for the NHS, which will allow us to invest more, whether it's in the workforce.
But at what number will you decide to do something like what they're doing in Scotland, what they're doing in Wales, what they're doing across the continent to arrest the spread of transmission? Are you just going to wait?
Now, that, Trevor, if I may say, that's more around winter pressures. The elective procedures back, that will take time. It's not just a question over the winter. It's going to take time after the winter, of course, to continue to work through those people that are waiting for procedures. Over the winter in particular, as we know, COVID particularly likes the winter, we set out our Plan A, but when it comes to winter pressures for the NHS and where they are significant, I readily accept that's where we've provided more support, an extra £5.4 billion of funding over this winter for the NHS and for the care system, because they're very linked in helping to deal with winter pressures. And that has provided support, for example, for more 999 callers, 111, ambulance services, a discharge fund for people that are ready to be clinically discharged from hospital but a care place that can't easily be found, so more funding for that. So all of this is helping. And let me be clear, I'm not pretending for a second that this is going to take away all the pressures of the winter. Of course not. We normally have tough winters, and with COVID, it's going to be even harder. But I think the NHS is doing a fantastic job, and we will support them in every way we possibly can.
All right, let's talk about another source of pressure on the government. I mean, not that you haven't got enough already, but we know that there have been record numbers of people landing on the beaches from the continent this weekend. In 15 months you were Home Secretary, we saw fewer than 2,000 a year landing. In 2020, that number quadrupled to 8,400, and we know this year it's increased to 24,000. That's 10 times the number when you were in office. Would you have tolerated this kind of breach of our borders?
Well, the first thing is that we are seeing a huge rise in irregular migration across the world, including, of course, Europe. And sadly, we're seeing many of these people smugglers, these criminals, these vile criminals that are exploiting people. And what we're seeing in the Channel is that sort of so-called business model of these smugglers. I mean, this route, this 21-mile route across the Channel, this is some of the most dangerous waters in the world. It's one of the busiest shipping lanes in the world, and no one should be risking their life across this. And it's the people smugglers that are to blame for this. And it's right that the Home Secretary is looking at every option that there is to try and break this business model.
That's all true, but the words "take back control" echo in my head, and it seems to me that the last thing that's happened is that we've taken back any control. In fact, we've handed it over to the people smugglers. Would you have tolerated this number crossing the channel were you Home Secretary?
Well, no one will tolerate this number. The Home Secretary has set out how this is...
does.
No, of course not. She's doing a huge amount of work in trying to break this business model. So the Nationality and Borders Bill that she's brought in front of Parliament now, coming back to the House of Commons soon, that is setting out a whole bunch of new measures and actions we can take. And let's be clear on this, Trevor, that people that are... This country has a great track record, rightly so, of providing security and protection to those people who are genuinely fleeing persecution. And we've done that recently just with Afghanistan, and it's been right to do that. But we do have to ask ourselves is that if people are trying to get to the UK from safe countries like France, are they genuine asylum seekers or not? And it is right to ask that, and it is right to change the rules to take that into account, and that's what the Home Secretary is doing.
All right, one quick last point on this. How are the talks with removing them to Albania or Rwanda going?
I'm not going to comment on any speculation. Nice try. I don't think you expected me to say anything else.
All right, let's talk about cricket and race. Now, I assume you'll have followed, like everybody else, the dramatic revelations from Yorkshire. Can you empathise with the Azim Rafiq story? Are there things in your own experience with which this resonates? Yes,
of course. And when I first heard about this, and that was when I really looked at it, was when I think it was a leak of the report that the club had done on this issue, and it really just shocked me in this day and age that the people doing this report would have these views that somehow being called is banter. It's not. It never has been. And yeah, you asked me about personal experience. Yeah, when I was growing up as a kid, I was called almost every day at school. I didn't like it then. I don't like it now. I think the good news is our country has come a long, long way since then. But clearly, not every institution in the country has taken that journey. And it's clear to everyone now that Yorkshire County Cricket Club is one of those institutions that has been stuck in the dark ages and needs to change. That process of change, I think, with Lord Patel there, has begun. But there's going to be a long way to go. And the ECB should be doing its job to make sure that this is taken seriously throughout cricketing in the UK.
Just in passing, I noticed that, and it's interesting, you can use the P word, I obviously cannot. But it's an interesting question about how we deal and talk about these things. But a specific question, really. We've been talking about all of these things, and you and I have talked about it before, cricket, football, in politics. When the government thought that the incursions on freedom of speech in universities were getting out of hand, it has intervened. There's a new piece of legislation. Don't you think it's time, seeing what we're seeing on football, more complaints from football referees this morning, daily revelations about cricket, isn't it time for the government essentially to stop trusting the sporting authorities, the ECB, the FA and all of that, who clearly, from what we've seen, failed, and for the government to step in the way it has done in universities on freedom of speech?
Well, I think it's a very good question, because I think the sporting authorities, whether it's football, cricket, they talk the talk, but what have they actually done that's really helping? And I remember when I was the Culture Secretary and overseeing sport in this country, I remember meeting the ECB then about issues of racial discrimination in cricket, and they were telling me what they're going to do. And look where we are now. Many years later, look at what's happening, look at what's being uncovered. I don't think the ECB has taken this issue very seriously. I think they need to take a long, hard look at themselves, and now this is a real test for them. And let's see if they can pass it.
And if they fail that test?
Then let's wait and see. That's going to be a decision for the Culture Secretary. But I will say this, that the Culture Secretary, the current Culture Secretary, takes this issue just as seriously as I do.
Health Secretary, thank you very much indeed.
Thank you.
Now, the UK government this week announced a review into how to prevent migrants crossing the English Channel, topic we've just been discussing with the Health Secretary. More than 1,000 people made that dangerous crossing in a single day earlier this month. And both the Labour Party and many Conservative MPs believe more action is needed. The Shadow Home Secretary, Nick Thomas-Symonds, is in Cardiff. Good morning, Mr Thomas-Symonds. Now, you've crunched the numbers, you've corroborated what we knew, that the There are record numbers of people crossing the channel, 300 in 2018, more than 24,000 now. Is the point that you were really trying to make that you think that Priti Patel is being too soft on undocumented migrants?
Good morning, Trevor. Good to join you. No, the point I'm making is that the Home Secretary is comprehensively failing in this policy area. And it appears the Prime Minister agrees, because he seems to be putting the Minister for the Cabinet Office in charge of a review of this. But the Home Secretary's failure is a dangerous failure. We have thousands of people risking their lives in these most dangerous sea lanes, the most dangerous sea crossing in the world. And if the rate continues as it is at the moment, if the rate of increase from last year to this year is repeated again next year, we'll have as many people risking their lives in the Channel as there are people in Priti Patel's constituency. Her incompetence on this issue is dangerous.
Yes, but let's just get clear why you think Priti Patel is failing. Is she failing because she's not getting people ashore safely, or is she failing because she's letting anybody ashore at all? What is the problem with what she's doing? That she's failing to stop the people getting here, or that she's allowing people to be endangered?
Let me tell you exactly what the problem is and exactly what I would be doing as Home Secretary instead. We need, first of all, to have a workable deal with the French authorities, which Priti Patel doesn't have. All she's interested in is diplomatic spats with the French government. That isn't what we need. What we actually need is to be looking not only at the coast, not only at the coastal patrols, but we need to be looking as well as at what is happening away from the coast, disrupting these vile people smugglers on the routes that they facilitate. People do not become refugees in northern France. This problem is about a far wider issue than that. Second, the issue of safe routes. The government should reinstate... Hang on, Trevor, let me just finish. Second, the government should reintroduce the DUB scheme, which is a safe route for unaccompanied children. 3,000 unaccompanied children was meant to help, closed then after 480. And finally, thirdly, let me just finish on this point. The government should reinstate the international aid budget, the 0.7%, and the Department for International Development, which tackled why people become displaced from their homes in the first place. So that's what I'd be doing, and that, I'm afraid, is what Priti Patel is failing on at the moment.
Yes, forgive me, I still don't really understand what your objective is here. Is your objective to provide safe travel for 25,000 people who want to land in Britain, or is your objective to stop 25,000 people who want to land in Britain coming ashore at the beaches?
My objective is to stop people risking their lives in the English Channel in the first place. One person risking their life in the English Channel is one too many. I've been to Dover.
So your point is you want to stop people coming here. That's the basic bottom line here.
No. Hang on, no, that's not quite what I'm saying at all. And I've already mentioned the issue of safe routes, and I've already said that would be a fundamental part of what I would be doing as Home Secretary. But what I'm also saying to you, Trevor, is that we have to prevent people risking their lives in the English Channel, because that is what is happening on a virtual daily basis at the moment. And Priti Patel is comprehensively failing to prevent that from happening.
OK, well, there's a perfectly reasonable way to stop people risking their lives, which is that when our boats, our Navy, sees them in the Channel, take them aboard and bring them back to Dover. So that's fine. 25,000 people landing on the beaches. That's OK?
Saving lives in the English Channel is, of course, OK. And by the way, people who demonise the Royal National Lifeboat Institute for saving lives at sea should be absolutely ashamed of themselves, frankly. Once people's lives are at risk
nobody's doing that here.
In the sea, we have to make sure we save those lives. The point I'm making is we need our policy to be calibrated in such a way that people are not risking their lives in the Channel in the first place. And that is where Priti Patel is failing comprehensively.
All right. Well, let's just talk about the proposals that you put out today. When you talk about safe and legal routes to help prevent people from using people trafficking routes, an example of such. I mean, how does that work?
Well, I'll give you two specific examples, Trevor. Let me give you the first example, which I mentioned a moment or two ago, which is the Dubs scheme, named after Alf Dubs, who escaped Nazi persecution on the Kinder transport in the 1930s. That should be reinstated. Everybody across Parliament understood that would have helped 3,000 unaccompanied children. The government closed it down after only 480. That needs to be reinstated. Secondly, we really do need to see the government's action on the Afghanistan resettlement scheme. We've had Operation Mitting, where our armed forces did a magnificent job in that airlift from Kabul airport. But what we've seen from the government is nothing in terms of how they propose now to help those people that they've promised to help. And my worry is that unless the government gets that right, that safe route right, we are going to end up in a situation where the possible tragedy next year of seeing people from Afghanistan in the English Channel, unless the government gets this right now.
Alf Dubs' scheme was, as you say, in a sense, inspired by his own experience as a child of the Kinder transport, who escaped Nazi occupation and so on. But what is different here is that the children that we're seeing in the channel have their parents with them. If the scheme were implemented, it would also follow, by the way, it wouldn't just be 3,000 children, it would be their parents, wouldn't it? And that would be part of your scheme, would it?
Well, look, we're already looking at the issue of family reunion, but let's not just mix up issues here, because the people who've already
well, it's just a natural consequence of what you suggested, isn't it?
Well, it's certainly family reunion is something that is already being considered and looked at. But the point I'm making is we mustn't mix up issues here in the sense that those who've already arrived here, Trevor, that you've just referred to, clearly the issue for them, and 98% of those who arrive claim asylum, is that their asylum claim is dealt with quickly and fairly. And one of the other major problems to this government is what they've done to the asylum system over the past 11 years. If you go back to 2014, 87% of asylum claims were dealt with within 6 months. By 2019, that had fallen to 20%. The government made a catastrophic blunder in taking away the 6-month performance target in our asylum system. And what we're left with now is a situation in our asylum system where claims are taking, in some cases, many years. It's not helpful to anyone in our asylum system. It's not helpful to the taxpayer. It is a failure of this Conservative government.
I don't know if you heard the Health Secretary talking about, first of all, the essentially institutional or systemic racism in health services, not just in the UK, across the world. And I wondered what your thought was about that. And secondly, the prospect of more people than the 5.9 million who are waiting for treatment in the NHS. Pick either of those two issues.
Well, firstly, in terms of the disproportionate impact of healthcare on Black, Asian and minority ethnic communities, that's something Labour has been raising throughout the pandemic. Keir Starmer appointed Baroness Doreen Lawrence to look at this, and the next Labour government will introduce a new Race Equality Act to look at precisely those disproportionate outcomes. Trevor, and I think that is absolutely essential and a top priority that we do. As regards the National Health Service in England this winter, we are in a situation where this week the government, with completely the wrong priorities, will try to drive through yet another top-down reorganisation when we need urgent action in our National Health Service now. Here in Wales, where I'm speaking to you from, where Labour is in government, We've set out a winter plan. We are focusing here in Wales, the Labour Party, on that investment to go into social services to reduce pressure on the NHS throughout the winter. The government for England doesn't have a plan to deal with this and should be putting its foot to the floor, put the pedal down on the booster programme to get that booster programme really up to 500,000 jabs a day. That will be one of the most effective ways of reducing pressure on the NHS in England this winter.
Nick Thomas-Symonds, thank you very much.
Thank you.
Even before the pandemic, staff and hospital bed shortages were leading to serious problems in the NHS. But for nearly 2 years now, doctors have been battling the biggest public health crisis since Spanish flu in 1918. And now there's an enormous queue for treatment, and waiting times are at their highest since records began. I'm joined now by Chris Hopson, the Chief Executive of NHS Providers, which represents most hospitals in England. Good morning, Chris. NHS leaders like yourself say that you're worried about how the health system's going to cope this winter, juggling the pressures of COVID-19, flu and the care backlog. How serious is this going to be?
Well, we are under an unprecedented degree of pressure for this time of year. And what we're experiencing is very, very high levels of volume of people coming into accident emergency departments. We know we've got the ambulance services under real pressure. But wherever you look, Trevor, right the way across the NHS, be it in community services, be it in mental health services, be it in hospitals, the NHS is under an unprecedented degree of pressure for this time of year. And of course, that's before the traditional winter peak. We know that the NHS tends to feel most pressure in early to mid-January. So there is a high degree of concern. But look, let me just say one thing really, really importantly, which is that obviously this is what the NHS is here for. We're here to provide the best quality of care to everybody who needs it, and our staff are working absolutely flat out to ensure that we deliver in line with the NHS constitution, because that's what we're here for.
But elastic doesn't stretch infinitely, does it? I mean, Sajid Javid talked earlier this month about the potential for waiting lists to climb to 13 million. And he says, well, of course, that would be if they hadn't done anything. But how high do you think it could get? And could this be a moment of permanent damage to the NHS?
I think it's very difficult to predict, Trevor, because we simply don't know how many people who didn't come forward during COVID-19, during the pandemic, will actually come forward. And therefore, we are in a bit of a guessing game about exactly how many. But the bit I can assure you is that NHS staff and NHS leaders are working incredibly hard at the moment to create that plan to ensure that we can get through that backlog as quickly as possible. And look, let me just give you a couple of stats, which is that, for example, after the January and February peak in COVID this year, we actually hit a very, very high peak of the number of people waiting for more than a year. So we hit 430,000 people. But hey, look, by October, we've actually cut that peak by a third because we're going flat out. So what we're seeing is that staff are going as fast as they possibly can to ensure we get through elective activity as quickly as possible. But we are working under some really important constraints here. I mean, for example, if you talk to an average district general hospital chief exec, they'll probably have on average 500 beds. What they're saying to us at the moment is 75 of those beds are out of action because they're effectively, we've had to take them out for COVID infection control. 50 of them are currently filled by COVID patients, and 50 of them, they've got medically fit patients to discharge, but we can't discharge them, partly because of the pressure on social care has taken another big leap, and it's got significantly greater over the last few months. So you've got 175 of your 500 beds are out of action at a point. 35% of your bed base is out of action in terms of the non-COVID care. And we know that in winter we're using 98, 99, 100% capacity of those beds. So it's not entirely surprising that at this point, because of COVID, because of the pressure on social care, because of the workforce pressures, that we actually don't have the capacity in the NHS that we need. And that is one of the real things that everybody needs to realise. We've gone through a decade of the longest and deepest financial squeeze in NHS history. So we've not been able to grow our capacity to meet that growing demand. We're putting huge pressure on our workforce, and social care is continuing to come under greater pressure. And those four pressures have been growing for a decade, and effectively you can't just turn around and solve all of them by turning on a sixpence. It's going to take time for the NHS to get back to an even keel and to recover from COVID.
We do know from experience, though, how that when we hit capacity, where the system gives, and that is in the fact that people have to wait. And particularly distressing, I think, is that they have to wait in emergencies. The Royal College of Emergency Medicine says that more than 4,500 people died following 12-hour waits in A&E departments in England last year. Now, and there are reports of people dying in ambulances while waiting outside hospitals. I mean, are we going to see more of that this winter?
Well, we know that what happens, Trevor, is that when pressure increases, the NHS doesn't break, it doesn't fall over, it doesn't reach a tipping point. What happens, exactly as you say, is that pressure comes on, waits, people have to wait longer. We know that patient safety becomes more at risk, and we also know that the quality of care comes under pressure. But again, I just really want to repeat this. This is what NHS staff are used to dealing with. I mean, to be frank, they're probably too used to dealing with it in terms of the degree of pressure that we're under. We will do everything we can to ensure we provide the best quality of care. But yes, you're right, the patient safety risk will increase. Trevor, the other thing that I think it's important to really talk about is the workforce. We've got 93,000 staff vacancies. We're spending £6 billion in terms of to cover those vacancies. And we're now asking the NHS to do the impossible. And as Nick Thomas-Symonds was saying earlier, this week the government will be debating the Health and Care Bill. We've got to have a proper approach to long-term workforce planning. And Jeremy Hunt, with a group of cross-party MPs, Greens, SNP, Liberal Democrats, Labour, and a large number of Conservative MPs, are basically saying to the government, in their amendment to the Health and Care Bill this week, we have to have a proper approach to long-term workforce planning, and that will help us avoid this endless repetition of problems in winter.
Thank you, because I wanted to come to this issue of staff. Everything you said is completely understandable, but of course you can't magic trained, skilled, qualified staff out of nowhere, and worse still, you can make it less attractive for people to serve in the health service. You recently said that you thought that the introduction of mandatory vaccinations for NHS staff could make the staffing situation even worse. Why? And actually, do you think the government simply just ought to drop that plan?
I think, Trevor, we know that life gets particularly difficult when you have two competing objectives and when you've got two sets of people who've got, in a sense, competing rights. And it's quite right. I mean, I've been very struck by the postbag I've had from patients who are saying, I think it's my right to ensure that I'm treated by a member of staff who's been double vaccinated, and I know whether they've been double vaccinated or not. Equally, I've had quite a few really strong emails and letters from members of staff who feel very strongly it's their human right to decide whether they get vaccinated or not, and they get to decide what they should put in their bodies. And the problem that you've got here is you've got those two conflicting rights. What we've said is we understand the logic as to why the government is going for mandatory vaccination, but what we've said really clearly is that they need to work with us over the next few months before that April deadline arrives so that we can ensure that as many staff as possible voluntarily kind of take up the vaccination. And we know that the best way of doing that is by having patient, encouraging, supportive conversations where we really understand why people have these misplaced, and they are misplaced, fears about why they shouldn't be vaccinated, work through with those concerns and then persuade them to be vaccinated. And again, what's particularly interesting is we know that there are particular demographic groups that have got high levels of vaccine hesitancy. We know, for example, that colleagues from black communities, we We also know that women who are thinking of getting pregnant relatively soon, they're people who've got higher rates of vaccine hesitancy. And what our chief execs tell us is if you can have a peer-to-peer conversation with people from the same group explaining why some members of that group, most members of that group, have had the vaccination, it can be very successful. But we just need to do this in a calm, patient and encouraging and supportive way. Because if we don't, we really do face a major issue in terms of losing very significant members of staff just at the point when we can't afford to do so.
Well, some of those people who are, as you put it, vaccine hesitant, I mean, they're medics, they are health practitioners. It's not like they're ignorant about this, and some just won't be persuaded. Where, in the end, are you going to come down on this? Are you going to say that ultimately, at some point, if people won't have the jab, they simply can't work in your hospitals?
Well, that's where we've got to. That's what the government has been very clear about. We're waiting for the detailed guidance, but all of us in the NHS expect that if staff haven't been vaccinated by that 1st of April deadline, they will no longer be able to provide frontline care. I mean, there is obviously the opportunity to explore with people about whether we can redeploy them to non-frontline care areas, but that's what the government has decided needs to be done. But as I said, Trevor, the key is for us to work with our staff to try and maximise the number of people who do take up the vaccine voluntarily.
Chris Hopson, thank you very much indeed.
Thank you, Trevor.
Austria has ordered a full national lockdown. Begins on Monday. Cases are rising fast across northern Europe, with the health minister in neighbouring Germany describing a national emergency. In the Netherlands, there have been riots over new restrictions. 3 people were seriously injured in Rotterdam and police fired warning shots at protesters. I'm joined now by Professor Linda Bauld, a public health expert at Edinburgh University. Good morning, Professor Bauld. Good to see you again.
Morning, Trevor.
Now, there's a 4th wave sweeping the continent, with countries like Austria, as I've said, recording record numbers. How worried should we be about that surge in infections on the continent?
Well, we're all looking with grave concern, actually, and trying to determine whether there are differences in the situation in Europe or whether it's just a matter of time until this faces us here. I mean, just briefly, to be a bit more optimistic, there are some reasons why there might be a different trajectory. Delta, the variant we're dealing with now, became dominant, particularly in Central Europe, later than it did in the UK. We opened up a little bit earlier, particularly in England, and so we dealt with our Delta wave in the summer and early autumn. We're still in it, of course, but not those big rises. And then the other features are around, unfortunately, because we've had high infections in the past, we've probably a bit more natural immunity in the population, as an immunity post-infection, particularly for younger groups who've not been eligible for vaccines. And then the other thing is that the vaccine rollout in Europe, if you look at the population level, these countries you're talking about, Netherlands even more vaccines than us, Austria a little bit lower, Germany roughly similar, but they deliver their second doses earlier for many older groups. So they're certainly seeing waning now, and they've also got in some parts of the population some pockets of hesitancy which are causing real concern. So it may not be the same, but, you know, it's very uncertain.
Well, I want to come to the issue of waning immunity in a second, but before we get there, I mean, in a way, there's an example much closer to home for us in England, and that is where you are in Scotland, where, in spite of what you said about the factors that might lead us to be more optimistic, the Scottish government has essentially been tougher, particularly in relation to transmission risk, and has taken steps to reduce transmission risks, which are not being taken in England. Does that worry you? Should we in England be following the example that you have in Scotland?
Well, I think if you look across the devolved nations, actually, Trevor, throughout this pandemic, there have been slight differences. I mean, let's just look at face coverings, for example. You're right, that is still required up here, as it is in Northern Ireland and Wales in some settings that it's not in England. And if you look at the surveys, people are far more likely to report they are wearing them here, even though I don't think compliance is 100% by any stretch. So that's a factor. We still have stronger advice to work from home. And then, of course, we have a modest certification scheme. Wales has just expanded theirs on Monday. I mean, we've continually had this question about should the UK use the same approach across all four nations. My personal view is it's confusing when the guidance is different. But on the other hand, the devolved nations have authority in relation to public health and indeed the NHS. It's a devolved responsibility. So we'll see. At the moment, if you look at the ONS infection survey, levels of infection in Scotland are a bit lower than they are in England. We've got real concerns about Northern Ireland. It's really difficult to make those direct comparisons. But of course, I would prefer that people were wearing a face covering in public places and trying to follow those protective behaviours to keep themselves and others as safe as possible.
Can you talk to us about this issue of waning immunity? What's the evidence that the protection offered by double jabbing is waning in a meaningful way, or a way that should affect policy?
Well, you've got two different types of evidence there. The first one is real world, where you can look at large epidemiological studies that just show what the risk is of being infected, of becoming unwell and going into hospital, depending on the duration or between your second dose and when that event occurs. And you can see that those who had their second doses earlier, there's more evidence of waning. You also get that from studies like REACT, where they're looking at a random sample of people in the population who are swabbed. That's one source of evidence. And then the second, of course, is from the trials, the Pfizer trial, for example, where they looked at the effectiveness of boosters. They were able to look at some of those features. So it's very clear that there is waning. It's not uniform across groups. But obviously, people have more vulnerabilities if they have underlying health conditions or they're older, and those groups got the vaccine first in most countries. So I think it's pretty clear from that evidence, and also from the studies that have been done in Israel, for example, looking at what a booster can do, getting that protection, for example, from antibodies for, say, 50%, 6 months post-second dose as it wanes, right back to over 90%. And that's what we're trying to achieve here in the UK.
Well, it's evident now that everybody thinks that the booster is important. And in fact, there's some suggestion that the booster gives you better coverage. I've had mine, and I guess I'm now told that I'm 93, 95, 96% protected. Is this now going to become part of our life, like the flu jab every year, that we're going to have some kind of booster against COVID?
I think that's scientifically uncertain at the moment. I'm not a virologist or an immunologist, but speaking to those colleagues, it's pretty clear that that is a possibility. The great thing about the boosters, Trevor, and I cannot emphasize enough the importance of people taking up that offer or going online for people in my age group and booking their appointment ASAP, 6 months second dose. Please, please do it. It's the key for this winter. Is that it kicks in almost within 7 days if you look at some of the studies. Or we have an immune memory that responds again to that vaccine. It's possible, like influenza, as you point out, that we will have repeat delivery of boosters in future, particularly for older age groups. But we don't know that yet. We need to study in real time the effect of these vaccine programs and see what happens. But you know, back to the first question you asked me, if we can really continue to deliver boosters at scale, we can continue to be cautious in our behaviour and try and adopt those protective behaviours, even if they're not mandated everywhere. You know, I'm really hoping we can, despite what Chris said about the huge pressures on the NHS, get through this winter without it being a disaster and without us having the situation we had last Christmas.
The Health Secretary rather dismissed my question that essentially, in truth, what the government's doing, even though it's not called this, is pursuing a strategy of herd immunity. Of course, that's become a sort of dirty phrase, but in truth, that actually what they're hoping is a combination of induced immunity and natural immunity will, as you just said, protect us through this winter. Now, he's got to say that because he's a politician. You don't. Is that in truth what's happening here?
I think if you look at children, there certainly has been a strategy just to allow this infection to go through our young populations. That's very clear to me. Different governments around the UK have had different views on that. And of course, we've had to follow the guidance of experts on the JCVI. But I think, if you look at the minutes from that committee in terms of the decisions that they took, they have huge expertise. But if you look at the minutes and if you look at some of the narrative, particularly at UK level, it certainly has been the case that this is a mild infection in children. It's probably better that they just get it. I don't think that's been a strategy for older age groups. We're worried about long COVID. The risks are not zero to young people. I would like 12 to 15-year-olds to be able to have their second dose. I would like us to consider what's happening in the US with vaccines for younger children in the long term. I think to have protection through vaccination, if it's safe and irrespective of age, is far preferable to allowing it to happen just en masse through natural infection.
Professor Bauld, thank you very much as ever. Now, the red wall crumbled this weekend. I am, of course, referring to Manchester United's 4-1 thrashing at Watford. Ooh. But any fans hoping that one day they could get to Old Trafford on the new Northern Powerhouse rail line from Leeds have also had their hopes dashed. That transport project has been cancelled, along with the eastern leg of HS2. I am joined now by Lord O'Neill, former Treasury Minister and Vice Chair of the Northern Powerhouse Partnership. Good morning, Lord O'Neill.
Please call me Jim. Trevor, good morning.
One of my colleagues said to me yesterday, is what the government did this week a boost to the Northern Powerhouse, or does it really feel like the great train robbery to you?
Well, I laughed to myself as a Manchester United fan when you introduced the topic. I'm not sure who's handling priority matters worse, the Glazer family with United or Boris and his team with this. I mean, they're both absolutely shambolic, to be honest with you. As my ex-chancellor, when I was briefly a minister, said, I think to the FT yesterday, that who would have thought announcing a package close to £100 billion could go down so badly? And I think there's two problems. The first one is this government seems to be completely inept at expectations management. This is a government that's talked, I think, factually, somewhere between 60 and 70 times about delivering Northern Powerhouse Rail in full, which is right at the core of the whole idea of the Northern Powerhouse concept, which obviously I'm in the middle of. They've sort of penny pinched. If this would have been the first time they'd ever made a policy announcement about Northern Powerhouse Rail, it might not have gone down quite as badly as it has. But what they've managed to do is disappoint virtually everybody, including Manchester, by the way, because as much as they still got HS2 and all the bits of Northern Powerhouse Rail, they haven't got what they wanted at the station either. And of course, the key part of the agglomeration is it's not really linking us up to Leeds properly, which was supposed to be the priority first part of Northern Powerhouse Rail and indeed the integrated rail plan. So, in isolation, if it would have just appeared from nowhere, it might not have been so bad. But given everything that's followed since Boris Johnson became Prime Minister, as we can see with the reaction across the board, it's pretty disappointing.
So the problem is both substance and handling. And by the way, we'll come to the football question a bit later. But let's listen to what Grant Shapps, the Transport Secretary, said. Or let me remind you of what he said, that the government plan would halve journey times in some parts of the north from Manchester to Leeds and so on by upgrading. Yeah. Surely that's a win of some description.
Well, I've spent a lot of time on it, and I keep trying to chat with real rail engineering experts, because indeed, if the government's plan delivers 6 trains an hour from Leeds to Manchester in 33 minutes, that is pretty good. But the problem is, with what they have specifically said they're going to do, I'm yet to find a single technical expert that believes it's deliverable, because they've got a new line from Leeds to Huddersfield, but from Huddersfield onto Leeds, it's essentially a planned upgrade of the existing one. And as anybody that travels across the Pennines on that line, never mind the M62, knows, you know, the line doesn't seem to be capable enough of dealing with what it has now, never mind more in the future. So it's just, if one could take for 100% certainty the great powers of digitalization, which is implicitly instrumental to this new plan, then it would be fantastic. But that's sort of assuming that the life and delivery of any kind of infrastructure in the UK always works so smoothly, and we know it. We know it doesn't.
The people who I suppose feel most aggrieved are people of Bradford who,
Yes,
as you, I think, have pointed out, have the youngest workforce in the UK. Unfortunately, that workforce now can't really travel to the places where there are the jobs. Is that, if you like, the central problem that with what the government's done that you have, that it's not really joining up the metropolitan areas of the north? I
mean, in the early days of trying to get the Northern Powerhouse idea adopted, I used to sort of inelegantly call it Manchester Leeds Pool, because if you take Manchester to any of those other three cities, the distance is less than the Central Line tube line in London. So the whole idea is to try and get all the people that live within that area, whether they be producers or consumers, it's about 8 million people, to be able to move around as easily as people do on the London transport system, and to have it all integrated. And obviously, for people in Bradford, they've got a sort of token gesture of electrification from Bradford to Leeds, but that means they've got to go the opposite way in order to go to Manchester afterwards. And obviously, that's like going from, say, I don't know, Richmond out to Reading before you come back into London. So obviously, for people from Bradford, it's particularly unhelpful. But I would add again, Trevor, that, you know, those of us that have been following it with great closeness for the past couple of years, they could have handled that better, because it seemed quite obvious to me that the Bradford link wouldn't happen. But yet they've allowed a lot of people to think that it would. Because it is quite the Bradford bit to do and have the train going through Bradford would be quite expensive. But I've seen since, and here's another thing to throw in, given the politics of all of this, and interestingly how the Labour opposition is now seemingly saying, even more powerfully than I recall them saying in the past, that they would deliver it in full, including Bradford, the political pressures might come back and get them to rethink again. I mean, the one thing is for sure with all this never-ending nonsense surrounding Northern Transport is that there's always some other idea in the next couple of years. So I hope in this case this is not the end of Northern Powerhouse Rail, because whilst there are bigger issues than transport, Northern Powerhouse Rail is central to the whole idea that I helped create.
Well, you're talking about the politics of it, and you're right. Most people, wherever they are, aren't going to be paying too much attention to the detail of it. But I suppose that the politics of this week could look like that actually this is a government which essentially thinks first about the South, and the North gets the leavings. In a sense, London has Crossrail, and nothing has been allowed to get in the way of delivering that. Delays, higher costs, all sorts of issues and planning and so on. But Crossrail is going to happen, come what may. But suddenly, the North, boof. You're not getting the thing that, as you say, everybody thought you were going to get.
Well, let's see whether they revise that, because, of course, the downside of very strong expectations creation is that it does create belief and a spirit and a desire and a passion. And that's partly what created the victory for them in the election. But if they want to stay in power, they've obviously got to show some evidence of following through. I would add, in addition, I smell that there has been quite a bit of the hand of the Treasury playing around to try and save a few billion here and there in the background. But again, for a strategic government that judges risk-reward of these things properly, you know, from what I can see, they're basically trying to save about $4 billion by not going all the way through to Leeds from the original announced plan for Northern Powerhouse Rail. And it doesn't, given the amount of money we're talking about here, that's about 10% of what was the original total. And that seems to me to be a bad risk-rewards judgment from people in the Treasury as well, to be honest.
OK, I can't let you go without asking you what might be called the Manchester City question arising out of all of this, which is that but for fans of Manchester United, there is some quite good news here because the high-speed line will continue to run from the south to Birmingham and then on to Manchester. So that huge percentage of Manchester United fans who don't come from Manchester at all are still going to be able to get to Old Trafford, aren't they?
They might find out if things carry on the way that they're going that they don't want to go there too much anymore. Manchester United needs owners that have profit with purpose rather than no purpose whatsoever. Completely shambolic how they're presiding over this fiasco. Completely shambolic.
Well, thank you, Jim O'Neill, for that. That considered and nuanced judgment on the government's performance thus far.
That's about the Glazers, that last part, by the way, Trevor.
Oh, sorry, I beg your pardon. OK, now we know. All right, well, look, that is as much as we have time for today. I would have loved to have carried on talking about the Premier League since my team is at the top. But we are going to end Trevor Phillips on Sunday for the moment. But, of course, we'll be back with The Take after the break.